Hello, welcome back to another episode of Medicine and Makeup, where I poorly explain medical problems while doing my equally as poor makeup. If you want to see more videos, remember to like and subscribe, so that way I know people want to see my videos, because I don't think anyone does. Today I want to talk about upper respiratory infections and how they have no affiliation with masks. So I'm going to start with bronchitis. Bronchitis is an inflammation in the lining of your bronchial tubes, which isn't great. I wouldn't assume it's great. Bronchial tubes, they carry air to and from your lungs, which is good. We all need something to carry air to and from our lungs. If we don't, we're not breathing. People with bronchitis will often cough up discolored mucus, and they'll also have like a rattling or a wheezing in their chest. Whenever I end up with bronchitis, honestly, it kind of feels like a rattling. So bronchitis may be either acute or chronic. So acute is like, not all the time. You don't have it all the time. You could have chronic bronchitis. This is usually caused by like asthma. And the reason why is because, well, when you have asthma, you're more susceptible to infections like bronchitis. Another thing that could put you at risk for bronchitis would be chronic obstructive pulmonary lung disease, so COPD or emphysema. Typically feels kind of like a cold. You end up with a cough, like you end up with mucus. It's delicious. And the mucus that you could produce could be clear, white, yellowish gray, or green in color, and rarely it might be streaked with blood. The mucus is going to be definitely coming out of your mouth because you're going to be coughing. You're going to be coughing a lot, and that sucks. As with like most illnesses, you'll end up with like fatigue, so you'll be like sleepy as shit. You'll be like good night all the time. You're probably never going to stop sleeping. I'm kidding. Oh my god, I'm kidding. Stop it. Shortness of breath, it's kind of a gimme because you're going to have trouble breathing when your lung tubes are infected. You're going to have trouble breathing when your lung tubes are infected. You may end up with a slight fever and chills. Honestly, when it ever came to my son being sick, that was how we knew it was bronchitis and not just a cold, was usually because of the fever that wouldn't go away after like 3 days. So like honestly, if you have a fever for more than 3 days for like any reason, you should definitely go get checked, only because at that point it could be an infection that's not going to clear up on its own. It could need some sort of antibiotic because it's probably bacterial. You could end up with chest discomfort, but it's kind of self-explanatory. Your lung tubes are inflamed. You should see your doctor if it lasts more than 3 weeks. It prevents you from sleeping at all, because these are like signs that it could be a pretty gnarly infection, and is accompanied by a fever higher than 100. Above 100.4 is get your ass to the hospital. If it produces discolored mucus, you should also go, because that's also a sign that things ain't going so well. If there's blood, definitely if there's blood, go to the hospital. If there's blood, go to the hospital, because it's not good. You don't want to be bleeding out of your insides. It's not good. So acute, because it's so cute, bronchitis is usually viral. It's not much to worry about. You hear me? Not much to worry about. So acute bronchitis, it's not much to worry about. So you're not dying. That's the good news. It's typically the same viruses that cause like flus and influenza. So like the adenovirus, rhinovirus, coronavirus, virus. These are viral illnesses. There's absolutely nothing you can do for a viral illness. And like honestly, like if your doctor tells you you have a viral illness, you have a cold. You have a cold. It's a cold. Now, mind you, that's not to say that there's no such thing as a dangerous viral illness, because there definitely is. There's things out there like meningitis. It's not all infections are bad. Viral illnesses, viral infections, it just means you have a cold. That's all your doctor's saying. Antibiotics won't touch it, because like you might be thinking like, it's time for me to get some antibiotics. I need antibiotics. That's not going to help viral illnesses. And like, if you start taking antibiotics for literally everything you have, you're going to end up killing your immune system. I don't want to do that because then you're going to end up with everything out there. The most common cause of chronic bronchitis is cigarette smoking and pollution. So if you have some sort of condition that would like compromise your immune system, then like, you know, it's more likely you're going to end up with bronchitis, only because you already have a compromised immune system, so it's easier for your bronchial tubes to find themselves infected and inflamed. There's also like exposure like to irritants like at work and stuff like that. So like I guess like for example bleach would be a good example. If you're always around these irritants and breathing them in, you're probably at some point going to end up with bronchitis or pneumonia or what have you. And if you have gastric reflux, repeated bouts of severe heartburn can irritate your bronchial tubes. It sucks. If it's happening all the time and you're getting back-to-back bronchial infections, you might want to get your lungs looked at for like COPD. It can lead to pneumonia in some people, but again, pneumonia, like, it's basically simple by antibiotics and it clears it right up as long as you catch it before it becomes anything. And honestly, the best ways to protect against bronchitis would be to wear a mask, wash your hands frequently, and don't smoke. But I'm not going to tell you what to do because I smoke. The next respiratory illness I'm going to talk about would be pneumonia. Pneumonia is an inflammation in one or both of your air sacs. The air sacs, your lungs, may end up filling with like fluid or pus. So this will cause a cough, phlegm, pus, it'll cause a fever, chills, and you'll probably have like a lot of difficulty breathing with this. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. The pneumonia itself can range in severity. As long as it's caught basically right off the hop, it's probably not life-threatening unless you have some underlying health condition. So pneumonia can vary from like mild to like severe, depending on the type of germ that you got the pneumonia from. It also depends on your age and your overall health. So if you have underlying health problems like, as we've talked about, the chronic obstructive pulmonary disorder or disease, what have you, then yeah, it's probably going to be a lot worse for someone with that, or someone with a heart condition, or someone who's just all in all not well. It's probably going to be a lot worse for that person than a healthy 20-year-old. The signs and symptoms of pneumonia would be chest pain when you breathe or cough, confusion or changes in your mental awareness, and that's mostly in adults over 65 years old. With pneumonia, you also have a cough that may produce phlegm. Fatigue, fever, sweating, shaking, chills, lower than normal body temperature in adults older than 65 and people with a weak immune system, nausea, vomiting, diarrhea, shortness of breath. So a lot of the symptoms of pneumonia are very similar to a cold or a flu. A newborn might not actually show any of these signs of the illness. They might show more like the I'm not eating, tired, restless, very grumpy, lethargic. Adults who are older than 65, if you have any of this symptoms, you should go see a doctor. And children younger than 2 years of age with symptoms, they're so fragile. People with an underlying health condition, so like COPD, heart issues, you know, that kind of jazz, any kind of underlying chest issues, you should probably go to a doctor. So people receiving chemotherapy or anything, or taking any medication or drug that might suppress their immune system, they should go see their doctor immediately. There's a lot that could cause it. There's like bacterial infections, there's viral infections. I'm not going to get into everything that could cause it. It's mostly like some sort of infection or fungi, bacteria, like even COVID-19. COVID-19 can cause it, and COVID-19 is like, okay, yeah, it's terrible. It's honestly, it's so bad. It basically is just a really, 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 really bad cold. Because what a cold is, it's a viral infection. Same with a flu. A flu is just a really, really bad viral infection. It's not really, really bad. It's not the same as like COVID bad. Honestly, like, it's all normal stuff. Don't smoke, like, get vaccinated. Practice good hand hygiene. Just wash your hands. That's all anybody ever asks. The way your doctor will probably treat this would be the same way as, like, bronchitis. So you'll probably get antibiotics just in case, no matter what, depending on how severe the situation is. You could end up hospitalized on IV antibiotics. The last thing I would like to talk about is a condition called pleurisy. So for those of you who don't know what pleurisy is, it's a condition in which the pleura, the two large thin layers of tissue that separate your lungs from your chest wall, becomes inflamed. Whoops. Also called pleuritis. Pleurisy causes sharp pain, pleuritic pain, that worsens during breathing. That sucks. Damn, I look good. Alright, I'm alright. So the causes are as follows. Viral infections, such as the flu, the adenovirus. Bacterial infections, such as pneumonia, so pneumonia can cause this. And fungal infections. I know I use a lot of this, okay? Autoimmune disorders, such as rheumatoid I've always pronounced it rheumatoid arthritis or lupus. Lung cancer near the pleural surface, pulmonary embolism, tuberculosis, rib fracture or trauma, certain inherited diseases such as sickle cell disease, and certain medications. I think I forgot to add to the rest of them, and the same would go for pleurisy. The way a doctor would find out you would have these would be either through chest CT, a chest x-ray, listening to your lungs. They could hypothetically check your white blood cell count. In some cases, the liquid will pool up. It builds up in a small place between the two layers of tissue. It's really gross. Pleuritic pain lessens or disappears because the two layers of the pleura are no longer in contact and don't rub together. Oof, it hides its own pain. Just like me. Another complication of this would be a telectasis. That sounds like telekinesis. Ouch, though, because it's a larger amount of fluid doing the same thing, except it could partially or completely collapse your lung, and it makes breathing difficult and might cause a cough. I assume it would cause a cough. It says it might, but I think it would. Empyema? EMPYMA. So the extra fluid can also become infected, as if the infection that caused the fluid wasn't enough in the first place. Now you need the fluid infected as well. That results in an accumulation of pus, so more fluid. This just keeps getting worse. This is often accompanied by a fever. I assume the whole thing start to finish would be accompanied by a fever, but hey, I've been wrong before. So the last point I wanted to touch on was, so a lot of people have been complaining in like the emergency room and whatnot that masks are actually causing fungal infections or any kind of lung infection. So I just wanted to kind of say that I did look into this, and that is not accurate, because from what I read, and which made perfect sense, the only thing in the mask is what you breathe out. So a lot of what people are experiencing is probably most likely anxiety related, so having trouble breathing because they are having trouble breathing in the mask. I'm not gonna deny that. It's not comfortable, but you won't suffocate from it. You could suffocate from it, they wouldn't make you wear them. Unless you already had a fungal infection or a bacterial infection or a viral infection, you can't breathe those in if they're not already in your system. So the masks essentially can't make you sick. They can't give you a fungal infection if you didn't already have one. They can't give you a viral infection if you didn't already have one. They can't give you a bacterial infection if you did not already have one, because you're breathing in the air that you're breathing out. Hopefully that makes sense. If you enjoy watching, please like and subscribe. Send this to your friends so more friends can tell more friends, and then I can have more friends, because I look like an idiot doing this with nobody watching. So, thanks. Bye.